Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's topic is type 1 and type 2 diabetes. Now, diabetes has become a national epidemic with tens of millions of people in the United States affected by this disease. Diabetes mellitus is always caused by an elevated blood sugar. If you have type 1 diabetes, it's because your body's pancreas is not producing the proper amounts of insulin. If you have type 2 diabetes, your body is not responding properly to the insulin produced. Insulin is produced by the pancreas. Now, the pancreas is a very interesting organ because not only does it make insulin, which is released into the bloodstream, the pancreas also has a second function in making digestive enzymes which are released into your intestine. So it's one of those dual-purpose organs in your body. Type 1 diabetes usually affects the young. Occasionally adults, but more often it's a young person's disease. And for some reason, the pancreas stops producing insulin. If left untreated, type 1 diabetes is always fatal. The amount of blood sugar in your bloodstream soars very, very high. A normal blood sugar might be, even after a meal, 120 to 150, where a type 1 diabetic who doesn't have any insulin produced by the body, their blood sugar may reach 700, 800, over 1,000. If left untreated, this can cause dehydration, something called ketoacidosis, and inevitably it will lead to death. So those patients with type 1 diabetes have to take insulin on a regular basis. Usually the insulin is self-injected 1, 2, 3 times a day. Sometimes type 1 diabetics have an insulin pump which delivers a set amount of insulin throughout the day. Now, insulin is important because insulin tells your body cells to take the glucose or blood sugar into the cells. Without insulin, your body cannot take the blood sugar or glucose, which is used as fuel by the body, into the cells, and so the blood sugar levels rise in the blood. In contrast to type 1 diabetes, type 2 diabetes is far more common. This usually affects adults, especially adults with a family history of diabetes. In other words, having a first-degree relative, especially a mother, a sibling with diabetes, puts you at a much higher risk of developing type 2 diabetes. Now, type 2 diabetes can go on for months and months before it's diagnosed, and the symptoms are more subtle. Your body is producing insulin in most cases, but your body cells are resistant to the action of insulin. And so your blood sugars gradually start creeping up. The symptoms of uncontrolled type 2 diabetes are changes in the vision, fatigue, constant thirst, and frequent urination. Most people with type 2 diabetes do not need insulin, especially when they start treatment. Oftentimes, oral medication, diet, and exercise are adequate to lower those blood sugars closer to the normal range. However, if you have poorly controlled type 2 diabetes, or if you've been on oral medication for a long period of time, several years, eventually your body may become resistant to those medications, and you may end up going on insulin. The side effects of uncontrolled diabetes are very frightening. When the blood sugar remains too high, it affects all the very small blood vessels in your body. And that can result in what a doctor calls end organ damage. What we mean by that is it can lead to blindness because of changes in your retina. It can lead to kidney damage and kidney failure requiring dialysis. It puts you at a much higher risk for heart attack and stroke. And it can also affect your nerves, causing something called peripheral neuropathy. Now, if you're lucky, peripheral neuropathy causes numbness. And the first place that is affected is the longest nerves of your body, which are the nerves going down to your feet. So oftentimes, diabetics, especially those who have had the condition for many years and maybe it's been poorly controlled, they start developing numbness in their toes, which can gradually work up into their legs. When severe, it can also start affecting the hands. I tell my patients if you're lucky and you have neuropathy, your only symptom is going to be numbness. For those that are unlucky, they may have burning sensation or a needles and pins sensation that is there throughout the day and night. The end organ damage from uncontrolled diabetes is not readily reversible. In other words, if we identify the diabetes and we get your blood sugars under control, a certain amount of this damage is going to remain. However, the damage will probably not progress as fast if we keep your blood sugars where they need to be. Now, the hallmark of treatment of diabetes is not only medication, primarily oral medication, but also sometimes insulin, but diet and exercise. Avoiding the simple carbohydrates in the diet is critical. Also, regular exercise helps your body take glucose out of your bloodstream and helps lower that blood sugar. Moderate intensity exercise, 30 minutes a day, is essential for good control of diabetes. Now, you don't have to go out and kill yourself for 30 minutes a day. You don't have to run a half marathon, for instance. If you simply walk briskly, on average 30 minutes most days of the week, you'll see huge benefits, not only in your blood sugar, but also in your blood pressure. If you can't walk, riding a bike or going to a swim class, any type of physical activity will help lower that blood sugar. So what is a normal blood sugar? If a person does not have diabetes, when they are fasting and we check their blood sugar or their blood glucose level, it should be less than 99 or less. If you are 100 or greater, then you are no longer in the normal range. Now, if you are between 100 and 125, we label you as having pre-diabetes. You may need medication, but pre-diabetes is a diagnosis kind of as a wake-up call, saying, you know, if we don't make some changes now, down the road you're going to develop diabetes. If your fasting blood sugar is 126 or higher on 2 separate occasions, then you have the diagnosis of diabetes, and then medication must be started. Besides fasting blood sugars, another test used is called the hemoglobin A1C. Now, the hemoglobin A1C is a nice test because it lets your doctor know what your average blood sugars have been doing for the past 3 to 4 months. Now, if a person does not have diabetes, their hemoglobin A1C would be 5.5% or less. If you have diabetes, your goal should be at least 7.0 or less. Many patients, when they're first diagnosed with diabetes, come to their doctor and their initial hemoglobin A1C might be 14 or 15, giving an average blood sugar reading of the past 3 to 4 months of 250, 300, 350. Because diabetes puts you at a higher risk for heart attack, stroke, and renal failure, it is very important to look at the other risk factors that you might have. Diabetics need to have good control of their blood pressure, and in fact we want a little bit lower numbers than we do for the general population in terms of that blood pressure. Same thing goes for cholesterol. Because a person has diabetes, or if a person has diabetes, their LDL needs to be 70 or less, whereas in the general population, maybe an LDL of 140 would be adequate. So, treating diabetes entails more than just getting the blood sugars down. It also means we need to take down the blood pressure and also keep the cholesterol down also. For those individuals with a family history of diabetes, or for those individuals diagnosed with prediabetes, it doesn't mean that you're destined to develop diabetes later in life. With proper diet, exercise, and weight loss, you can avoid having that diagnosis of diabetes or developing diabetes later in life. Although being diagnosed with diabetes is very serious and very frightening for patients, it's not a death sentence. With proper medication, diet, and exercise, diabetics can live a normal and full life. This has been Dr. Tim Moser with MedRounds. Until next time, wishing you the best in health and prosperity. Take care.